Housing and Urban Development Secretary Dr. Ben Carson helping to lead the administration's efforts to revive the economy while mitigating the viral pandemic. He speaks to One America's Jennifer Franco about the tools being used to accomplish that goal.
Every state in America today has the testing capacity and the supplies to be able to move into phase 1 reopening.
The Trump administration is touting a boost in coronavirus testing as it paves the way to reopen states that have been shuttered for months due to the outbreak. States nationwide are reopening in phases based on plans tailored to fit their specific needs and how badly they were hit by the virus. HUD Secretary Ben Carson is leading the White House Economic Revitalization Council and spoke to One America News about those efforts.
There are 13,000 community health centers throughout the country that are going to be used for testing, and there are multiple other sites, particularly in some of the affected areas where there has not been good service before.
In addition to increased COVID testing, the White House is coordinating with the CDC and local governments to ramp up contact tracing. It requires individuals who have come into contact with an infected person to be identified, tracked, and isolated to stop more cases from popping up. But it sparked a debate among Americans.
There are a lot of people in some communities who are not all that excited about contact tracing because they feel that it impacts upon their privacy, and they're not 100% trusting of the medical establishment and of the government.
44 states and the District of Columbia reportedly have plans to expand contact tracing. Public health leaders, along with members of the White House Coronavirus Task Force, agree it's necessary to moving forward with reopening plans.
If we do not respond in an adequate way when the fall comes, given that it is without a doubt that there will be infections that will be in the community, then we run the risk of having a resurgence.
But the states lack the number of personnel that are reportedly needed to meet the demand outlined by some experts. Two top former federal health officials from both the Democrat and Republican administrations are calling for a $46 billion public health investment in any future coronavirus relief bill. Now, part of that money would be used to boost contact tracing nationwide. The chances of that happening, though, appear to be unlikely.
There's a lot of things that we have learned on the basis of this pandemic, which will allow us to act very early if something else comes along.
Carson says the administration has already learned how to suppress the virus when a spike in cases have emerged.
Do we need to do a national contact tracing program when people aren't particularly anxious to have that done? I'm not sure I'd be willing to force it upon people.
Jennifer Franco, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.